to the Law Factor Live. Most cancers are hereditary. Well, that's false. For many cancers, there is no known single cause. Now, what about stress, doctor? Because a lot of people say, oh, cancer is brought on because you're full of stress.
That's a very interesting question. I don't think there's been enough research on it, but my personal take on it is that stress changes the immune cells of the body, and there are a few cases that have actually researched cases that have actually shown in other diseases that stress actually changes the way the cells react to an insult or an injury. So perhaps cancer is actually an insult to the cells of the body, and if your body is stressed and the cells are not capable of reacting normally, then perhaps stress plays a part in the development of it. It doesn't cause it, but perhaps the body's fight against the injury that then becomes the cancer. That's really what happens.
Is that part of the reason why? But I've heard many times that when you have cancer, you must stay away from stress.
But I think when you have cancer, all the cells in the body, not only the part of the body that's affected by the cancer, but your body in general is under stress. You have physical stress from the cancer, you have emotional stress, and you have psychic stress. And if you want to be able to fight this and give it your best shot, then I think you really want your cells operating at the optimum capacity, and reducing the stress in your life will certainly cause that.
Okay. All right. So I think the most basic question I can ask, and I should ask because everyone thinks they know exactly what it is, but what is cancer?
I don't know. And I'll tell you why. There's so much research being done now that there's changes. Essentially, cancer is the change in the behavior of a cell in the body. They become overreactive. So if it's a cancer in the lung, then there are many types of cells in all the organs of the body. So each organ is made up of different cells, and it's a change in one of those cells, and it behaves almost like an aggressor. It just moves through that body. It multiplies rapidly. It behaves abnormally. It doesn't even, under a microscope, it looks different. If you try to challenge it in the lab setting, it behaves differently to what the normal cell would behave like. So cancer is essentially a change in the function and the structure of a normal cell.
Okay, well, thank you for that definition, but I also have to say that last night Dr. Owen Gabriel gave an excellent explanation and definition of cancer. So for the people who missed out, and there he is, full house at the surgery yesterday, and if you missed it last night, I do know that there are plans, hopefully, God willing.
Hopefully, God willing, this will be the first of the annual.
Okay, so Doctor, tell us about what happened last night.
Essentially, we had what we call Pink Ladies Night. It was the Rodway Medical Center is essentially our goal really was to provide a team approach to health. So not just taking care of your body, but also educating you, and we focus on prevention. October was Breast Cancer Awareness Month, and we thought that it was with so much breast cancer being spoken about, we thought it was a great opportunity to get women after work to come learn to educate themselves, learn something about breast cancer and how to recognize the early signs of it. To connect, to share, we had survivors who would give their take on it. We had an excellent talk by Dr. Gabriel, who basically answered questions not only on breast cancer, but on cancer in general. We had some great eats, we had some prizes.
It was a wonderful night.
And we also, and I thought personally that we had to show people, especially women who had never come for a mammogram before, what the machine looked like. because you always hear people say, I'm not going for the mammogram, I hear it hurts, I hear it squishes your breast. Some people think they're being slid into a machine. So I thought that if they saw what the machine looked like, then coming for what is generally it's not the most pleasant experience that you are going to go through. But if you're familiar with the procedure in advance, you've seen the machine, you know what part of the machine is actually going to squish your breast, because you know what? Your breast will be squished. So it is what it is.
I've had a mammogram, and I have to say it was not as uncomfortable, and it was not painful. Everyone said to me, "Oh, be prepared. It's going to hurt. They're going to squish your breast." And it wasn't like that. And as if to me, if I didn't feel something that was a little bit of discomfort, I'd be thinking, well, that maybe it's not being done properly.
Well,
but Stevie, let's hear from you. What did you think about last night? I mean, you are a survivor. Congratulations.
Thank you.
So you perhaps, in your own way, would know just as much as the doctor does. Because I find that when people, if not more, yes, because you are the one who's experiencing it. So for you, what did you get out of last night?
I thought it was very important just to let people know that, you know, once you're being diagnosed with cancer, it's not a death sentence. Everybody thinks, well, you know, you're going to die if you have cancer. So that was the one of the main messages, and that one can survive,
And
you know, and live. Yeah. I was diagnosed in 2010.
Where? In St. Lucia?
In St. Lucia. I always practice my self-breast examination, and I found a lump, and I had lumps in that breast before, which I had removed. So I was a bit careless because another lump, and I did not go to the doctor, and because I was doubting myself, and I think people do, you know, is it a lump, is it a gland, you know, that kind of thing. And it took me a couple of months before I went to the doctor. And when I went to the doctor, he said, well, you know, he thinks, you know, it should be investigated. I went for ultrasound and mammogram, and the ultrasound saw the shadow.
Solid.
Yeah, saw the shadow. And then I realized, this is serious. It's not like last time.
How does that feel?
Frightening. Frightening. I went for biopsy, and the doctor, the surgeon, when I went back for my visit, he did say to me, I suppose through what he saw, he did try to prepare me, but that goes over your head, you know. I'm going back for my tests, my results, and it's just, you know, like before, it's another lump. And then he told me I had, it was malignant, and it was confusion. I was overwhelmed. I felt faint. It was just a horrific time. And then I stopped thinking about me, and I started thinking, oh my God, my mother. How am I going to tell my mom? How am I going to tell my sisters? You know, this has happened to me. It's.
At the time, did you think this is a death sentence?
At the time, yes. I felt it's no good making plans. You know, you've got cancer. You're going to die. You don't have much time. It's no good making plans for the future, kind of thing. You know, even after I had gone through my surgery and chemo. I was like, you know, I would like to buy a new car, but no. There's no point thinking about going to the bank and trying to get money to buy a new car. You know, the future kind of was hazy. There was no future as far as for a long time. And then I met people like Dorothy, who spoke to me and made me realize, you know, look at me, look what I've been through, and there's life after cancer.
How does it feel when you're actually taking your treatment? Because you hear all different types of things, you know, about the choices, and if you choose, or if you're, you know, of course, you're in consultation with your doctor, and you both decide, well, perhaps this is the best route for you. How does that feel, the administration of administrating of chemo and decision making?
When I was diagnosed, when he told me I had cancer, he was on the phone, doctor, wonderful doctor, and he was talking to Dr. Gabriel, and he'd already made arrangement. This was the Tuesday, and he made arrangement for the Thursday for me to have surgery. And in your mind is like, I want this thing out. You know, he just told me I've got cancer. I don't want this. I want this thing out. And I went home, told my parents and everything, and my friends came home, and they came home with Dorothy. And I was saying, like, I was very confused, very scared. And I said, well, on Thursday I'm going to have surgery. And they said, no, you're not. You're not going to have no surgery on Thursday. We're going to step back, we're going to talk about this. First of all, you need a PET scan to see what's happening in there. PET scan is a map of your tissues and that. You know, okay, you might have it there, you might have it other places. So you need a proper investigation, and you just need time to step back and breathe and think about what you've just been told. You know, gather yourself. And I was like, oh my God, they've already made an appointment for surgery. You know, how do I phone the doctor and tell him I'm not going to have surgery, I don't want surgery? And it was very, very, very confusing.
When you told your mother, how did she take the news?
Well, we had lost my father through stomach cancer. And that was why I was so scared and fearful and anxious to tell her, because I'm the one that's there with her. And so I called my aunt and I said, you know, this has happened to me, and I think you better make your way home before I get there to tell my mother. And so some of the family and friends had already gathered home before I got there. And my friend was hiding under the car park, and my mother was like, how come she's still why is she still there, you know? But everyone was waiting for me to come. And
incredible support.
Yes.
And everybody gathered, and Mum, you know, my sister knew, and we cried. But she is somebody who believes very much in prayer. Our strengths come from God. And I found, as a cancer survivor, cancer patient, that was part of my treatment. Prayer, faith. I don't think I would have been able to get off that bed, especially when you're going through the chemo, if I didn't have my faith. And sometimes I was like, you know, my God, sometimes I didn't have the strength to pray, and all I can say is, Jesus, help me, because I was so weak.
How does it feel having chemo? I know it's different for everyone, but how did it feel for you?
The first 4 sessions were quite hard. The vomiting was really violent and horrible. But there's drugs that can, you know, help, but they are extremely expensive. Extremely expensive. But my sister's a pharmacist, so she was able to get me some drugs to help the vomiting. Sometimes after every session, the sensation is different. Sometime I felt as if the chemical, there's a very strong chemical that's going through your whole system. And there was a time when my eyes was feeling as if it was burning. I could just feel it under my skin. But because Dorothy had come and said to me, well, this will pass. You'll feel like that for a few days, but then this will pass. It's not going to be like that all the time. And I used to hang on to that thought, you know, okay, tomorrow's going to be a better day.
Well, I'm so glad that you hung on to that, because you're here with us, and you look so healthy. Now we're going to go...
Serene.
Isn't she? We're going to go to the break, and when we come back, we're going to continue a little with Stevie, and also ask the doctor her opinion on the care that Stevie received. So stay with us. This is The Law Factor Live. We'll be right back.